to see, but the radical left Democrats want to shut it down. I mean, it's up to them. We have a great economy going. You saw the numbers yesterday. They're fantastic. The economy's doing well. And you know what happened? The Democrats want to shut it down. And they want to shut it down because they want to give billions, ultimately trillions of dollars to illegal migrants, people that came into our country illegally. Some of those people are criminals, but they came into our country illegally, and they want to give them the essential over years, trillions of dollars. And our people aren't going to stand for it. They also want to have open borders. They want to have men and women's sports. They want to have transgender for everybody. These people are crazy, the Democrats. So if it has to shut down, it'll have to shut down. But they're the ones that are shutting down.
We'll continue to talk to the Democrats, but I think you could very well end up with a closed country for a period of time. And we'll take care of the military, we'll take care of Social Security, we'll take care of the things that we have to take care of. A lot of the things that Democrats fight for, which in many cases aren't very good things, will not be able to be paid.
Since he took office, President Trump has taken a meat axe to our healthcare system. It's vicious, it's cruel, it's mean. People are sicker, people live less long because of what Trump has done. $1 trillion in health care cuts, 15 million people kicked off health insurance, decimating rural health care systems, shuttering hospitals and clinics. Health care is less accessible and more expensive for millions of Americans. It was one of the great achievements of the last 2 decades. And Trump is undoing it with his Republican colleagues. And why are they doing all this? To give billionaires a tax break. We're now facing a cliff on ACA tax credits. Millions of Americans and small businesses who rely on the ACA premium tax credit are going to see their health care skyrocket, their costs. On average, premiums will increase a shocking, 93%, almost double, if the tax credits expire. 24 million Americans, including about 5 million people who will lose their coverage entirely. And when it's 24 million Americans, it's many more people who are affected, because that's direct people, but what about their families and all of the people who depend on them? So it's a huge number of people.
Issue at this point. I've been hard at work the last couple of weeks preparing for a possible government shutdown. Our chief of staff has this as a major work stream. The good news is, again, we got a lot of sort of stuff that's on the shelf for how this works. We're in close coordination with other agencies, with other components of the federal government, and we're crunching the numbers right now to see how much funding does the FCC have, when exactly do we have to shut down if there's a lapse.
The U.S. is just hours away from a potential shutdown. The Congress has just a few hours left to avoid the disaster. But why is the U.S. government facing a shutdown? What does this mean for the U.S. economy? Here's the latest. U.S. Democrats and Republicans have failed to reach a deal on averting a government shutdown. The U.S. Congress is thus locked in a continuing resolution to fund federal agencies past September 30. There is a difference between the House and Senate, notably in areas of health care funding and other program changes. Result: the current U.S. government funding expires on September 30. How likely is a shutdown? What is the possibility that Donald Trump's government may come to a standstill? Well, as of now, negotiations are unresolved and lawmakers have traded short extensions and demands. Several analysts believe that a shutdown is indeed possible if no compromise is reached before midnight of September 30. While political leaders have been saying that they intend to avoid a shutdown, an agreement over a continuing resolution is not in sight. Thanks to senators, as they are struggling to agree on spending levels, with some wanting to maintain current funding, even as others push for increased or decreased allocations. Moreover, the current political climate is such that there are significant partisan divisions within Democrats and Republicans to find common ground on a CR. There are internal divisions within the Democratic Party regarding funding levels for different sectors, such as healthcare, education, or defense.
We are ready, we are willing, we are able to find a bipartisan path forward and reaching a spending agreement that actually keeps the government open, but meets the needs of the American people in terms of their health, their safety, and their economic well-being, related to lowering the high cost of living as opposed to allowing tens of millions of Americans to experience dramatically increased health care costs. What we will not do is support a partisan Republican spending bill that continues to gut the health care of the American people. Over the last several months, Republicans have created a health care crisis in the United States of America, largest cut to Medicaid in American history, triggering the possibility of a $536 billion cut to Medicare if Congress does not act because of what happened with the One Big Ugly Bill. Republicans have refused to extend the Affordable Care Act tax credits, and as a result of that, millions of working-class Americans are going to experience skyrocketing premiums, copays, and deductibles at a time when America is already too expensive. Hospitals are closing. Nursing homes are closing. Community-based health centers are closing because of what Republicans have done in their One Big Ugly Bill. The Centers for Disease Control are under attack in the appropriation bill that Republicans have put forth in this month. The National Institute of Health under attack because of what Republicans have done in their appropriations bill this month. And they're limiting the ability of children and families to get vaccines. This is a five-alarm fire in terms of the Republican-caused health care crisis. And that's why Democrats are determined to turn things around.
Some of the riders that Donald Trump's Republicans are pressing for include permanent extension of 2017 tax cuts, border security funding, healthcare funding cuts. Republicans have proposed cuts to healthcare programs, which Democrats strongly oppose, and tariff authority, which prevents Congress from blocking emergency declarations that allow President Trump to impose tariffs on Canada, Mexico, and potentially other nations. Well, the immediate impact would be that thousands of federal workers could be furloughed or required to work without pay. Some services pause, others continue. Primarily essential services remain. Airlines warn a shutdown could slow flights. Controllers and TSA will have to work, but without pay. Training and certification work will halt, possibly causing delays. Past shutdowns hit U.S. GDP slightly. Lost pay, slowed government contracts, delayed permits and inspections. The 2019 partial shutdown showed measurable drag on activity. Some benefit programs continue. For example, Social Security checks already authorized, but others include new processing, claim reviews, certain grants can slow. But is this the first time the U.S. is staring at a shutdown? Not really. Congress has flirted with shutdowns several times, but actual multi-day shutdowns have been fewer. Since 1977, there have been 10 shutdowns. In the last 5 years, there were close calls and short funding fights, but not a full year shutdown. Why does this happen every year? A shutdown isn't automatic. It's a political outcome of Congress not finishing appropriations by the fiscal year end, September 30. Leaders attach policy riders or use CR negotiations to extract political wins.
We have disagreements about tax policy, but you don't shut the government down. We have disagreements about healthcare policy, but you don't shut the government down. You don't use your policy disagreements as leverage to not pay our troops, to not have essential services of government actually function. You don't say the fact that you disagree about a particular tax provision is an excuse for shutting down the people's government and all the essential services that come along with it.
Bottom line is, a shutdown is possible if Congress fails to act, and it would have real effects on millions of workers and services at home, with knock-on ripples abroad. And the clock is ticking.